Hi, I'm Prof. Keng Shen Ling. I'm the head of School of Psychology at Sunway University. I'm also a clinical psychologist.
My name is Hui Yin. I'm a counsellor and I am also a centre manager of Malaysia Mental Health Association. I guess one of the potential benefits will be more exposure to mental health conversations. Like maybe through events, talks, or I know like Sunways, they have like clubs. Yeah, so more people would be more open to talk about mental health. Yeah, I think that would be the one of the potential benefits. Whereas I think one of the unintended consequences that I noticed would be the gap between awareness and also understanding. I do see we know what mental health is, we're aware that mental health exists, but some people, they might not be fully aware or grasp their understanding about what it means. So, which in turn, some people might delay seeking help, or they will just assume counseling is just for, for very, very serious issues or very, very serious chronic mental health conditions, which is not entirely true. Hence would lead to delay in seeking help.
Yeah, I certainly agree. I think simply promoting awareness of mental health alone may not be entirely sufficient. It's also important to actually reinforce that with facilitating a deeper understanding about the nature of mental health issues and the fact that seeking help is not a sign of weakness, right? So I think there's this aspect about destigmatization, which is a very important part of promoting awareness. But yeah, I think the other aspect of it is also promoting a deeper, kind of more realistic picture of what mental health issues are, how they're experienced and so on and so forth. So I think to respond to the question, I think overall there's certainly a lot of benefit, right? Because it kind of allows people to just generally be more aware of, the possibility that there are different mental health issues that may be out there that they may experience or others may experience. But I think, as I mentioned, it's also important for them to sort of go a deeper level in terms of really knowing how to recognize signs and symptoms of a mental disorder and when to seek help. And maybe to add to what you have said, I think one possible unintended consequence of, I guess, more kind of superficial promotion of mental health awareness is, I think for some people, there might be this risk of self-diagnosis where they just sort of learn about, this certain mental health condition from how they're portrayed in social media or movies, and then begin to sort of put labels on themselves based on what they perceive, in terms of things that they struggle with versus what is portrayed on, for example, social media. And I think the danger of that is that they, may kind of fall into a pattern of I think there's this term called self-fulfilling prophecy. They may behave in such a way that they think is consistent with that diagnostic label that they put on themselves without actually properly seeking professional assessment and support.
Yeah, I do agree with that as well. I think it's quite common from where I'm working at. I do receive multiple inquiries, and when people seek help, they would tend to share I have this condition, I have this disorder. And when I try to get more information, and I realize that actually they have never seen any psychiatrists, they have never seen any clinical psychologists, not any mental health professional, but they just know about all this information from online, from Google, social media, TikToks. And there are a lot of information out there. Which then it could be not so positive outcome.
I think, but hopefully, I guess, with that increased awareness, people are more aware, times when they might be struggling, but also knowing that it's very important to always seek professional assessment, right? As opposed to just relying on self-diagnosis, or kind of making I guess, assumptions about what they might be going through, or in some cases dismissing. I mean, that would be the other side of the extreme, right? Just denying problems that they may be experiencing, which of course can also lead to harmful consequences. Yeah. I think that's a pretty broad question because there are two aspects of it, right? There's this culture of over-productivity, if I'm hearing the term correctly, and then social media influences sort of another aspect to it. Maybe I'll just focus on the first aspect, right? Where I certainly think that, if students were to be living in an environment that constantly is conveying to them that you have to achieve more, you have to do more, nothing that you're accomplishing is ever enough, right? If that's that sort of culture and mentality that they grew up in or they study in, I can certainly see ways in which, that sort of environment can make it more challenging. And, it may actually not be very conducive for students learning to take care of themselves and to develop better resilience. But of course, there's a lot of individual factors, right, that can affect how different people cope, right? Like, for example, some students, may not necessarily be high achievers by nature, in which case they, if students are able to sort of draw boundaries, right, in terms of like number of things that they're committed to so that they're not overcommitting themselves, then I can see how, for these students, that actually probably puts them in a better position in terms of not being overstretched and overcommitted to the extent that they feel like they cannot cope. So I think, yes, there's this cultural aspect, but there's also an individual aspect to this where I think it's quite important for, it's not just students, but also I think individuals in general, right, to be mindful of like how many things that they're committing to and to be able to draw boundaries so that they're actually able to attend to self-care on top of attending to their academic or other responsibilities.
Yeah, like what you said, I think it's very true. It's not just students per se. It's like everyone in the society, can be working adults. Yeah, it can be children. Yeah, and I think the individual aspects comes as well. Like different people have their different coping mechanisms, and maybe some of them, they are more high achievers. They want to achieve more, but they might have a better coping mechanisms, and hence it might be still manageable for them. Yeah, but I do think that I do see quite a number of clients that are coming in because of having the need to keep doing something. Like they feel like they just can't rest. Can be also due to burnout. And even when they rest, when they sleep, they'll wake up feeling tired, which could be very difficult for them actually. And I think on top of that, with social media influences, I think that adds to another layer.
For sure.
Yeah, like because in social media, I think there is this curated images that's showing like how others are successful, which will make people feel more like they are falling behind.
Right.
Yeah, and also adds to the validation and the pressure that they originally already have.
Right.
Yeah. So yeah, I think definitely in a culture of constant productivity, then of course it might not be as healthy for the individuals if they don't have coping mechanisms that work for them.
Right. Yeah, I think it's like the two factors in combination. It does make it challenging for people to actually kind of have the time or that sort of to develop internal resources to like attend to themselves, right? Just think of it like if you're working or teaching or studying, right, in an environment that's always saying you need to do more or else you're not enough.
Yeah.
Right? You can see how that creates some kind of internal pressure for this person to always be like, okay, I just have to keep working or studying, and just never feel like they have this permission to allow themselves to rest and to take care of themselves. And then you pair that with social media, which essentially I think is a double-edged sword, right?
Yeah.
I mean, there are ways in which social media can, I think, positively, influence, how we carry out our day-to-day life.
Yeah.
And at the same time, as you already mentioned, there's also downsides to social media in terms of being a source of things such as cyberbullying or other sorts of behaviors, right, that we do not have control over. And the other thing is, it also serves as this constant source of distraction, right? It's like if I'm feeling sad, I'm stressed, right? For a lot of us, that include myself, I just have this automatic tendency. I just like turn on Instagram, right? I'm just like mindlessly consuming information, whether or not this information is useful for myself. So then my mind is very much conditioned to always wanting to kind of grasp for some information as a way to cope, as opposed to actually learning to just sort of sit with, like, what am I feeling, right? And to actually give myself an opportunity to just sort of reflect and to process my emotions, or just to simply rest. I think it's, we are such a culture of constant doing and achieving that many of us just simply have lost that ability to just say, I just need to pause and rest. And literally not do anything, or actually do something that's nourishing. I think oftentimes we're just so conditioned to, that culture of achieving, and sometimes to the detriment of our own mental health.
I totally can relate to that. Like even myself, I would also tend to, doom scrolling. But I have to be really conscious about it, and really have to like stop myself from doing it. I guess it's definitely, there are a lot of values, I think, to integrate structured mental health education into the curricula. Like I know, like for private schools, they do have this kind of classes. It's not language, it's not in their subjects, but they would have classes to teach students about like what emotions are, like how do you cope with certain emotions, and how do you feel, and how do you manage your stress and things like that. So I think, yes, I think it would add a lot of value to it. In university setting, I think it should be something that's more relatable, something that's more practical, if it's going to be like set up in that way. And I think if it's more of like a rigid or academic kind of subject, then it might also in turn cause some pressure. So I guess if it's going to happen in university setting, then for myself, when I foresee it, I think I would prefer something that's more activities based.
Right.
Something that's more practical, can be engaging with each other. I think that would be helpful.
I think I agree with that. I think there's certainly a lot of benefits to building in resources to promote mental health awareness, psychoeducation, as well as teaching of coping skills to students. And I also think maybe it would make more sense to carry out these initiatives maybe in a context of like student wellness programs, as opposed to necessarily being part of an academic curriculum, because I can see ways in which that could be challenging if you make it like a subject where you're have to get like a grade of A, B, or C for like learning how to cope with stress.
Then there's this pressure to do well again.
Right. Yeah. So I think certainly there's a lot of benefit, but I do agree with you that maybe the question is about how we incorporate it, right? In what context would that incorporation be the most beneficial for students? And so maybe, more in the context of, I think, student wellness services, I think that certainly would be one area where I think it would be appropriate to introduce, a more structured sort of mental health curriculum. But I guess the other side of the dialectic is that, I think learning effective coping skills is also it's a lifelong process, right? So I don't think it would be realistic to say, I'm just going to introduce this one curriculum, and then by the end of 8 weeks, everybody's going to graduate and being resilient. And, I mean, of course, I guess the skills are meant to be developed over time, and we all learn through experiences, through failures, through struggles. So I think these sorts of curriculum, I think for me, it's just more like a starting point in terms of like saying, okay, these are the tools, right, that we can provide you with, right? And also acknowledging that it's not going to like solve all problems necessarily, but rather it's just like a set of tools that they can now learn, right, and incorporate into their daily life, right, as they go through university life. And I think it is, actually a really critical stage of life when I think everybody can benefit from, learning more coping strategies and having more awareness about mental health. So I think at a fundamental level, providing wellness and mental health services for students would be a pretty fundamental, aspect of promoting mental health awareness. I think that was in the original question, right? So how would universities do that? So I think that is a pretty fundamental aspect of that, to ensure that services are available for students who are struggling with mental health issues. But ideally, also thinking about like preventative programs, right? So it's not just like you're providing like crisis services or like counseling for students who are already struggling, but also like thinking about providing wellness-based programs that can increase resilience so that students are less vulnerable to developing mental health issues, more generally. So I think there's a need for both intervention as well as prevention aspects, when we think about promoting mental health efforts on campus.
I do see, like, it just reminded me, like, there are schools out there where they will send their teachers to be educated on mental health literacy. Like, I think it brings us back to that first question, like having the mental health awareness, like they are aware that there are mental health issues, but they might not know like how to go about it. So like I know like schools, they would send their teachers to be trained and to recognize more of the warning signs and how to go about it, which I think in university settings, perhaps that would be also something that would be helpful, like for the staff or the faculty members to know like what can you do when they see certain students in crisis, or they see certain students having certain symptoms or having certain issues.
Yeah, for sure. I agree. Yeah, so it's about empowering, right? Faculty members, and I would say, staff, faculty members, even students, right? So I know, for example, at Sunway University, we have the peer counselors, right? So I think this is a wonderful initiative where it focuses on empowering students, right, to have some training in terms of being an active listener and supporting their peers who might be going through some struggles, right? So I think the effort ideally is multi-level, right? So it's not just, we're just going to be implementing a specialized mental health service, but rather we're also empowering the entire community in terms of being more knowledgeable about signs and symptoms of mental health conditions, and knowing when to provide support. And then the other aspect of this question is about promoting responsibility and growth, and I think that certainly is something that should always be kept in mind. Whenever we provide support, for any particular individual, that I'm sure you kind of know in doing counseling work, like when someone comes and sees us as therapists or as mental professional, it's never about working with this person just whatever presenting problems that they may have, right? There's always this underlying goal of empowering the client, right, to building the life that they want, to achieving the goals that they want, right? So I think within the context of counseling or therapy work, I think in general, that is the goal, what we are trying to accomplish, right? It's about working with the client so that the client actually is able to cope with whatever kind of problems that they have, or achieve the goals that they have, as much as possible, fostering that independence like over time. So I think that's certainly a very much integrated part of the work. And of course, at the university level, we also offer accommodations, right, for like students who are struggling with mental health issues. And I think in implementing that policy, right, it's important to also keep in mind, right, this other aspect of accountability and responsibility, right? So it's like, to what extent is accommodation appropriate, right, given a particular set of struggles or mental issue a particular student presents with, so that it doesn't become a scenario where these policies or accommodations end up being unhelpful, if that makes sense, where it doesn't provide an opportunity for the student to actually still learn and grow through that process. So I think, this is when, it's important to sort of establish such policies, right? Providing accommodation and at the same time empowering the student to getting the help they need so that they can actually, over time, accomplish their academic goals, as much as possible through supported learning.
Yeah. I guess that's always the end goal for them to be more independent, to reinforce their independence and not like rely on therapists or counselors, but really able to have their own coping mechanisms and able to go through their struggles, even when they are not like seeing a counselor or a clinical psychologist.
Right. Yeah. Well, I hope that you find the session today to be helpful, and just wanted to, remind everyone that, if you're ever experiencing any struggles, emotionally, psychologically, there's always resources available on campus to support you. And also know that we as faculty members are here, as an additional source of support if you're ever experiencing, any kind of issues with mental health, where, you like our support.
It's okay if you're feeling constantly tired or constantly feeling like you're exhausted. Just know that you're doing your best, and that's always enough.